Dr. Swaminathan, is it possible that the travel ban which we now have, which probably makes a great deal of sense for so many countries around the world, could in fact last for several months? The reason I ask is it's at a stage like this when you want people to be vaccinated as soon as possible with the hope that the vaccine does work. And until the United Kingdom brings down its rates, then would it be safe to open up travel to the UK? And to bring down the rates in the UK would take time. That's the key issue. You can't have it overnight. It would take a few months. So could this be a protracted travel ban?
So a couple of things I'd like to say in response to that. The first is that we're going to learn more about this strain in the coming days and weeks. So the questions that we're interested in is it more transmissible? Does it, infect, go from person to person much more easily? Does it result in worse clinical outcomes? Is it more severe clinical disease? And thirdly, does it have an impact either on treatments like monoclonal antibodies or vaccines? So we only have a hint about the first question. The UK scientists who've done a lot of modeling around this, and you showed the explosive growth of this variant in the southeast of the UK over the last few weeks, suggests that it's more transmissible. But there have been mutations in the past which have also become the dominant variant going forward. So it may be just another variant that has an advantage in spreading and therefore becomes a dominant strain. So I think we need to wait for those. But on the travel, the first thing I'd like to say is that the UK is one of those countries that's doing a lot of whole genome sequencing and therefore is able to track this, very closely in real time. I suspect that as more countries look at their whole genome sequencing data, and we encourage countries to do much more sequencing than is being done now, that many more countries might find that this variant or related variants might already be in the country. Several European countries have already reported the presence of this variant. And because it's been in circulation since September. So it's likely to have spread internationally. And I think the more we look, the more we will find. The other important point here is that whether it's this variant or another variant, the public health measures are the same. And it's really important that all countries now put in place measures to control this virus and bring down transmission to as low levels as possible. And we know what those measures are, the testing and the tracing and the quarantining and the isolation of the positive cases. So those measures need to be put in full, place regardless of which variant it is.